Hi, this is Dr. Rudra Mohan and through the Oral Health channel, today we're going to be talking about the genetic predisposition when it comes to oral cancer. Let's start. So I get a lot of calls regarding oral cancer and the queries around it. I recently got a call from a viewer who said that my father unfortunately had oral cancer, but I don't have anything as of right now, but I'm really scared if I would get oral cancer as well. So that obviously sparked my mind with the inquisitiveness to find out at the back end of scholarly articles where I could find out what is the actual genetic predisposition when it comes to oral cancer. Now, before we go into the genetics about oral cancer, let me tell you about how cancer works in general. So when it comes to genetics, very simply put, every person is a composite of mixture of their mother and their father, right? Their biological mother and their biological father, and they inherit the whole gene composition is composed half by the mother and half by the father. So one gene is actually consisting of two alleles. One is a maternal allele and one is a paternal allele. Now coming to the fact that all of the genes, right, are inherited, and also that these inherited genes could be mutated in lieu of cancer. Now also that there could be mutations that were already present in the alleles of the parent. At the same time, there could be somatic mutations. Now I have told this line along for a very long time that the genetics is a loaded gun, your lifestyle is the trigger. So mutations can happen with the genetics itself, that you got the mutated allele from your parents as well, and mutations can also happen after you've been born and you are consuming things or having a lifestyle that is very deleterious to your health, and that's where the DNA damage is happening, which is leading to somatic mutations. Now let me tell you, just one time somatic mutation doesn't do anything, but it has to happen 3-4 times with repetitive insults to the DNA. Now when it comes to somatic mutations, it's very simple. It is the environment that you're living in, the food that you're consuming, the products that you're consuming, such as tobacco, smoking, alcohol, preservatives, fast food, junk food, all those things that have so many chemicals that are actually carcinogenic. That means that they can cause cancer through DNA damage. Now any sort of carcinogenesis happens after DNA damage. How does DNA damage happen? Through mutations. That's not the purview of this video. So let me tell you what happens in reality in a normal person who is not having cancer at that point of time. You have something known as tumor suppressor genes. Just like you have a security guard or a bouncer outside a club, your tumor suppressor gene is also a bouncer outside the club that you known as the cells of the body. The cells have three things that are required for it to function. It needs to repair its DNA when it's damaged. The second thing, it needs to know when to stop multiplying, and it needs to know when it needs to die. As simple as that. This is the basics of how every cell cycle should work. So if these three things happen, that the cell is undergoing DNA damage, it has forgotten how to stop multiplying, and it has forgotten that it needs to die of a programmed cell death known as apoptosis, there's a high likely chance that you might get cancer. Now, how is this kept in check? That's why you have tumor suppressor genes. You have p53, cytochrome P450 and so many other things. I don't want to get into the molecular details, but you have a lot of genes which are known as tumor suppressor genes that are the bouncers, and they keep all of these things at bay, that you don't do DNA damage. We repair the DNA damage. The cell knows when to die off and when to stop dividing. But when the lifestyle is such that somatic mutations take place in these genes, because of the fact that you are causing oxidative or DNA damage to these genes, they become rogue themselves. They undergo mutations and they're not the same the same functionality. So what happens is, basically, for example, you have a club and then you have the bouncer outside of it. You drug the bouncer or you get them drunk or inebriated. what's going to happen because of either the altered sensorium, that they're not able to function cognitively, or they pass out. You won't have that bouncer right outside the club, and thereby people can enter and can cause damage to the club. It's as simple as that. That's the same thing how it works when you go for a lifestyle that is deleterious, that causes DNA damage, causes mutation in tumor suppressor genes, causes the fact that the cells become rogue, they tend to multiply, and they don't know when to stop, and that's how cancer happens. Coming to the greatest question, what are the odds? Unfortunately, there is no conclusive evidence for what are the odds of the genetic predisposition of oral cancer, because the number of genes are plenty. It's still in the nascent stage, despite the fact that cancer has been around for about, I think if I'm not wrong, more than 80-90 years. But the evidence states that more than genetics, which also plays a role, it's the lifestyle. So if you have had anyone unfortunately in your family who's had oral cancer, especially your parent or your sibling, you might want to be very careful about what your lifestyle choices are, and you would want to be very careful about the fact that you need to get yourself checked very regularly, even if there is a small nodule, a small ulcer, even if it's an aphthous ulcer, a small growth, any sort of pre-malignant conditions that are happening, because they also work in the same manner. So when I said about the somatic mutations happening, it basically is the start. When you're getting a pre-malignant condition, that is why we make sure we tell all the patients who have undergone any sort of pre-malignant condition in the mouth that you need to stop the habit, otherwise it might turn into cancer, and sometimes it does turn into cancer. I'm going to repeat that line once more. Genetics is the loaded gun, your lifestyle is the trigger. So that's it for today. Please like, share and subscribe, and do press the bell icon for important updates. If you want to get in touch with me, this is my WhatsApp number and my social media handles. Please feel free to comment, criticize, suggest, doubt, even inquire in the YouTube comment section. So that's it for today. Thank you.